Welcome to IBDSmart. This app is designed to help you communicate with your healthcare workers regarding the activity of your inflammatory bowel disease, specifically ulcerative colitis. It has been developed by the Gut Health Network of Otago University with the backing of the New Zealand Society of Gastroenterology. In this video, I will guide you through the completion of the Simple Clinical Colitis Activity Index, or SCCAI. Once you log on to IBDSmart, you'll get to this window. Here there is a choice of two tabs to click on. The Simple Clinical Colitis Activity tab, which is designed to be used for routine reporting of your disease activity. For instance, when you are attending a scheduled checkup or reapplying for medications. The red Report a Flare tab gets you to complete the same SCCAI questions, but will directly alert your healthcare workers that you are concerned about your ulcerative colitis at this point in time. So let's complete a routine SCCAI. Firstly, you should notice that the questions in the SCCAI relate to how you have been feeling in the last 3 days. The index is arranged into 5 sections. The first 2 questions are very similar and relate to the number of times you have had to open your bowels. The first question is about how many times you went during the day, and the second is about how many times your bowels disturbed you after you went to bed. Both are reported as an average for the day. The third question relates to how rapidly you felt you needed to get to the toilet, i.e. the urgency of defecation. 4 answer options range from no urgency, when you had a normal control, to the feeling of having to hurry to the toilet, to the next level when you really had to get to the toilet immediately, through to the worst level when you actually had an accident. Let's just put a couple of scores in here. The fourth question asks how much blood you've seen in your bowel motion, ranging from none to a tiny amount, i.e. a trace, through a moderate amount, which is when it's occasionally obvious blood, to a severe amount when blood is usually seen with each and every motion. The fifth question relates to how you've felt your colitis has affected your general health. It may be that you feel very well, or maybe you feel not quite right. That's just below par. You might feel poor, very poor, or feel that your ulcerative colitis makes you feel absolutely terrible. The next 6 questions all relate to problems that might be connected to your ulcerative colitis, but not concern directly to your bowel motions. They can all be answered in a yes or no. The first is whether you have painful, red or swollen joints. The second relates to eye problems, and if you click on the little eye icon there, you will see examples of scleritis and uveitis, 2 common eye conditions that might occur. The third one relates to mouth problems, and again, clicking on the icon gives you some examples of what we might see. Important skin problems are also illustrated here. We want to know if you're getting painful, deep ulcers, or tender, violaceous, raised lesions, often on the shins or forearms. The last question is about problems around your bottom, such as tears, cracks, or tender lumps surrounding your anus. These are important to tell us about. Lastly, there is a comments box for which you can communicate anything you think we need to know. You will see right at the bottom there is a running total score, and once you are happy you have told us everything we need to know to help you, then you can press the Send Survey button. The total SCCAI score will then be emailed to the medical carer you have already nominated, along with a summary of the scores you have completed to date. Pressing this will also bring you back to this page, the IBDSmart Dashboard Startup page. Once you're ready to leave IBDSmart, press down here on the patient info icon and then sign out. I hope this has made things easy for you. If it is not clear, simply send us a message via your comments box to your medical team. Kia ora.